So hello everybody, I'm Jim Durrett, Mayor of Montgomery County, and this is another one of our spotlights, for lack of a better word, series. And we're actually talking to somebody today that the last couple of years, we probably talked more than we ever really wanted to talk. But Joey Smith, who is the Public Health Director for Montgomery County. And let me just set this story straight. Joey is not actually an employee of Montgomery County. He's an employee of the state of Tennessee. And so as we go back 2.5 years, and go back during the beginning of COVID, a lot of people thought that Joey worked for the county, but Joey actually works for the state. But during that time period, we had a lot of collaboration, a lot of communication, went real good. But we won't talk a whole lot about that, but we're going to talk about some other things. So Joey, if you would, just tell us about Joey Smith.
Well, I graduated from Hopkinsville High School.
Were you born in Kentucky?
Born in Gary, Indiana.
Gary, Indiana.
The Jackson 5 were born there.
Okay.
And my parents moved everywhere. My mom met my dad at Fort Campbell, and they moved up to Indiana to get work. And that's where I was born. And then they moved to Soddy Daisy, Tennessee, and I've lived in Clarksville some, but ended up graduating from Hopkinsville High School. I joined the Navy right after high school, and then went to Austin Peay to use my GI Bill money.
Yeah.
And that's where I got to choose where I live after graduating college.
So what started you down this public health director role?
In 1999, I'd already graduated from college. I was working for an engineering company. I saw that there's this job opening at the Montgomery County Health Department for environmental specialists. And my degree was GIS and environmental hazards, which is natural hazards and technological hazards. And I didn't know that an environmental specialist was a fancy word for a health inspector. And so I did that for about 9 years. And in 2008, the state called me and said, would you like to be the director of Dixon and Humphreys County Health Departments? That was a great opportunity. I did that for 3 years, and I got to learn how to just run a health department on a smaller scale.
Right.
And Andre Fresco was the director here in 2012, and he called me at home and said, I'm about to move to Yakima, Washington. Mayor Weiland might call you and just want to give you a heads up, because we let him know that there's someone that already lives here that's running the health department, and that's what happened, is how I came back home to be the director here at Montgomery County.
Awesome. So you really started as an environmental specialist with the health department.
Yes, sir.
Then went and became director of public health in another county.
Yes, sir.
And then came back here in 2012?
Yes, sir.
Awesome.
Next month will be my 10-year anniversary.
Awesome. So you've worked for state government for how long?
22 years.
22 years, wow. And basically it's all been health related, but the environmental side was totally different from being director of health. Without a doubt, wasn't it?
Absolutely. But you know, I in those 9 years, I get to hear the lingo and go to several of the same meetings as the nurses and medical staff, and learned a lot about it just from being from the outside.
Well, to me, you're the subject matter expert. What do you think? Tell me something significant since you've been director of public health. We won't talk about COVID, but some things that you brought to the county or to the community that you're really proud of.
Well, my degree is GIS and geographical information systems, and just looking at hazards and mapping them. And so I worked on the national level and the state level on mapping how long people were living by zip code. That was one of the very first things I did. And Robert Wood Johnson now has a link where you can type in your home address and it lets you know the average length of life there. And that was based on some of our early work. But probably one of the coolest things is when the county health rankings come out each year, there is 30 something measures. And so it might say obesity, that there's 30%. I was taking my daughter to Disney World, and she woke up from a nap and just said, "Where are we?" And I said, "We're in Macon, Georgia." Now, she was 4 years old. She has no idea where Macon, Georgia is. So if you called me and said, "Joey, what's our obesity level?" 30%. You don't know if that's good or bad,
Right.
or like how close are we to Disney World,
Yeah.
and how far away from Clarksville are we? And so it made me think right then, it's not about where we are, it's about where we want to be.
Mm-hmm.
And so I created this report called the Top 10, Drive to the Top 10, and I list where we are, and list if we can close this gap between us and this county here, if we can just get, for every 100 obese adults, if we can just have 5 of them drop their BMI below 30, we'll be in the top 10. And I did that for every measure.
Yeah.
I've used that as a tool the last 9 years.
It saves lives too.
Absolutely.
Yeah.
You know, my on this journey, I even did the calculations and thought, by the time I retire, the population of Montgomery County is going to be close to 300,000. If people are living 3 years longer when I retire, that's 900,000 years.
Wow.
And it's almost 1 million. And just think, it's just 3 more Christmas mornings. What if we could have that? And that makes it worth it even on the individual level. But we're close. We can really do this and live 1 million years longer. And so that's probably been that encompasses a lot of my work that I've been doing over the last 2 decades.
Well, you know, you're talking a lot about statistical data, and I know that's very important. I know it is, and not that COVID wasn't a challenge, but having no data, that really made that. And I know because you and I lived through it.
We did.
But every day we were building statistical data.
We were.
And it helped us along the way. And I think with not only with your involvement, but with everybody else, and getting Austin P involved, their GIS department, kind of goes back to your roots, really. But getting them involved, I think it really gave us a better understanding of what was really going on in our community.
It really put Montgomery County in the front, because other counties weren't doing this. They didn't have an Austin P mathematics department in their backyard.
Yeah.
And so we have an advantage here in Clarksville.
Yeah. Yeah, we had, I remember we had some really good expertise help from Austin P putting all of our statistics together. And I won't go into any names, but they were really, really big help. So Austin P saw this job opening, and boom, here we are today, huh?
Here we are today, and you know, today they were just asking me when I came in, what do you do since we're not doing COVID? And I said, we're addressing those things that were killing us prior to COVID. Obesity is and smoking are 2 related things that impact 8 of the top 10 causes of death. Those things are still there, and so I'm shifting back to those day-to-day operations at the health department, and bringing that information up front to folks of what causes poor health, what causes us to live longer.
Yeah. Joey, and this may be a hard question, but obviously, as long as you've been here, you like working for the government.
Yeah.
Any dislikes about it?
No dislikes, and it's probably because I've never viewed it as I'm working for the government. I viewed it as I work for the people.
Yeah.
And you and I've had several of these conversations over the last 8 years. Each year I bring my budget in front of the budget committee and the mayor, and I pretend that this is not my money because it's their money.
Yeah.
And that's how you have a balanced budget, and how you be a good steward of people's money.
Yeah, y'all have a lot of working parts over there too. A lot of grants, and I think, you correct me if I'm wrong, and I'm gonna be wrong, but out of all the people that you have over there, only like 3 or 4 of them are truly Montgomery County employees.
Sure, absolutely. prior to the 1980s, all health departments across the entire state were state employees. And in the 1980s, under Governor Alexander's term, and late 70s, there were a few mayors that said, look, we have some of our nurses can't get a job at the local health department, because I don't know if you remember, but you would get on a state register, and you might be number 41 down on the list. And so they were way down on the list and couldn't get, their local health department might have an opening, but couldn't reach them. So Governor Alexander and then Governor McWhorter started working out creating these county positions on the state grants that they give to counties, and said, we'll just start every time we have a state nurse vacancy, we'll turn it into a contract position, and that way you can hire them under your HR system and you can reach them then. And that's worked really good. Even though I have two HR, I have some state employees and I have some county employees that are paid on that state grants. But also, sometimes there wasn't the money for a state employee or a new state contract employee, and that county said, we still would like to see another nurse there. And they created what we call a true county employee that's paid out of the general fund. And so knowing that history of it over the last 22 years, getting to ask some of the folks that hired me, how these things going to be, has probably helped me the most explain it of how we got here.
Well, I'll tell you a funny story. You know, I worked for the Clarksville Street Department for years and years, and at one time the health department did mosquito control. And it wasn't my idea, but somebody said, well, let's bring that over to the city of Clarksville, and now the city of Clarksville does that. So,
and I think right when you came on board, you were telling me how the rabies program used to be under the health department also, and we had an animal shelter that was under the city. And I think it was in 2002, I went and found some of those old records of where David Selby went in front of the Board of Health, and he went in front of the county commission to ask, could there be this thing called animal control? Because before it was just a place you dropped off your animal. They didn't have, the officers had no authority to go and pick anything up until then. And so,
wow, how times have changed.
I know it.
So Joey, what does a typical day as the public health director of Montgomery County look like?
It is running those day-to-day operations at the health department and our WIC services, which is a nutrition school. Folks come into the WIC office. If you have a child and you're within that income, you can talk to one of our registered dietitians. And the dangling carrot of coming in to have a nutrition conversation is you get an EBT card loaded with vouchers. This is really cool. We just do this each day, and we don't know the impact of it. But even during COVID, in the last year, there was $2.7 million of Washington, D.C. money that was spent at Montgomery County grocery stores on those EBT cards. So it's great that outside dollars are coming into Montgomery County, but also what's great is 8,000 Montgomery County citizens got some nutrition education on ideas of, instead of buying baby food jars, we could teach you how to make baby food out of some green beans and squish it up. And they do those classes at WIC. And so these are some of the cool things that go on over there.
And you do different stuff every day?
Every day.
So, I don't like talking about COVID, but when we go and you start back, you talk about COVID, and we're in Veterans Plaza right now in the IT department, but y'all started off testing here. And lines were out on the road, and we all got together and we kind of put our heads together. But during that whole time period, you're dealing with this worldwide epidemic, pandemic, whatever you want to call it, but yet y'all are still doing your WIC services.
Still trying to run
that health department. That had to be pretty tough.
It was tough, and but it forced us into doing things that we wanted to do, and we always had an excuse for it. Like, we wanted to do more telehealth. And there was things that we could do on the phone that if you just needed to call and talk to your doc or a nurse practitioner about your prescription, before you had to come into the health department to do that. You had to take some time off work, get transportation here. It forced us to make an avenue and make this vehicle of telehealth and telenutrition. It's always bothered me anytime I see someone waiting for their ride outside the health department. And it makes me think, I wonder if their visit could have been done telephonically. And so it made us do those things. So there were challenges, but it created opportunities that made us take those opportunities.
So, what do you think are some really short-term and long-term challenges that y'all will be facing? And not necessarily related to COVID, but you know, there's these variants that are still popping up. So just talk about some short-term and long-term challenges.
You know, in 1980, the obesity level in Tennessee was 10%. Today it's about 30%. The adults, the 20-year-olds in 1980 are 62 this year. The adult diabetes rate is about 12%, because those adults that were part of that 10% are now in that close to that senior citizen age. That's the short-term problem, is 12% of our citizens have diabetes here. The long-term challenge is we have 30% adult obesity right now. Does it mean in 30 years from now we could have 30% of our senior citizens have diabetes? That is my constant message of if we could walk more, and if I could control the guy I shave with every morning and make him behave a little bit, and take the stairs a few times instead of the elevator, I can control and at least delay diabetes. And so that is my short-term and my long-term challenge. And believe me, I want Montgomery County citizens to live 3 more Christmas mornings.
That's awesome. That's awesome. I remember, Joey, and I might booger this up a little bit, but I don't know, 4 or 5 years ago, where you started this smoke-free campus thing, and we got you got high schools involved and created signs and all that stuff. That was
Healthier
really,
Montgomery is coming back.
Exactly.
Like we're already having those conversations now. It had to get put on the back burner because we could not go. Our health educators could not go into schools during COVID, and so it's part of our conversations right now. Montgomery, in fact, Clarksville just got put in one of the top of the lists for being the best garden community, and that's still in some of my thunder for later on in here. But we're already having those conversations of healthier Montgomery, and I'm getting neighborhood by neighborhood healthier.
That's a pretty daunting task of, you know, you talk about somebody that works in our IT department or building codes or whatever, but I mean, you're looking out for the health, or trying to look out for the health of over 220,000 people. And so what can you do that would make a difference? That'll save 1 life, it may save 20, it may save 50. It may save 100.
And I look at it, instead of the 220,000, I think of it as a neighborhood at a time. And you and I have been to those neighborhoods where we go and walk with them and put a sign up. And that's the funnest part of our job. And you know, it doesn't feel like work.
That's awesome. So I'm gonna change a little bit. So you're interviewing somebody for a position in the health department. What do you tell them about why they should come to work for the Montgomery County Health Department?
I tell them the story of why I came to work here. I was working at an engineering company, and anytime you get a real job after college, a real job, you get 2 weeks paid vacation.
Yeah.
They don't tell you that if you have to meet the plumber or if your child is sick, it comes off those 2 weeks.
Yeah.
You come to work for Montgomery County, you get a vacation day every month. It's 12. Now, we work 5 days a week.
Yeah.
And so that's 2 weeks and 2 days of vacation days. But my problem was like having a sick child. If you're a young individual with children, or if you get sick, you don't want those vacation days to come off. Montgomery County also gives you a paid sick day every month. A lot of businesses and organizations don't do that.
Right.
They don't. That's 24 days off a year that we
That's a lot.
get.
That's a lot.
That of sick days and vacation days. Another thing is that you might look at the pay. Montgomery County is very competitive when we compare ourselves to sister counties like Sumner County, Rutherford County, Williamson County. We look at how and we make adjustments there, but we also, what makes it great about being here, if you're in one of those other communities, and in fact, if you're in 90 other counties or 100 other Tennessee cities, you're part of the Tennessee Consolidated Retirement System.
Mm-hmm.
You come and work for Montgomery County, you don't miss a lick, you pick up where you left off right there. And that makes it great that where you were, if you were at 6 years, you come here, it's just like you were at 7th year of in your retirement system. So we're part of that big system. There's not a lot of organizations out there that have a pension plan and have a 401k or number. We have both. Yeah. That you need to be part of this. We encourage the 401k and Roth IRAs, but you're going to be part of the pension plan right when you come in here. And these are the reasons I came here. Yeah. And these are the reasons I'm still here.
So Joey, off script a little bit, and I've said in some of these other interviews that we've done, to be fair to everybody, I've provided the questions I was gonna ask everybody, but I wanna hold true to my nature and ask something that's not related, or that's we hadn't talked about. And I don't know that you can answer this, but since COVID, we've seen so many people, especially in the healthcare industry, get burnt out and leave that industry or leave that field. Don't you feel like there are going to be challenges to get people back into that industry again, like more people going to nursing school and all of that stuff?
It is. The good thing is that there's people that are in nursing school that didn't experience that burnout. Yeah. And one of the things that we've already started doing is going over and giving presentations at the nursing programs, especially here at Austin Peay. We have one in our backyard. That's
very good one.
Very good. And just having those conversations that we're about to have openings. You all are about to be my colleague, even if you're not at the health department. As the public health director, I'm in constant conversations with our hospital and our local providers in our community. You'll probably be working for one of them. You might be at a nursing home. We're in conversations with them. You're going to be my colleague. Right. And but know that you can be my colleague and help us work upstream and think about, what if we didn't have 30% diabetes in 30 years from now? Mm-hmm. What could we be doing today upstream? Yeah. What if the people in 1980 could have went back 30 years in the 50s? 1950s, that was the baby boom. Yeah. If you look at Clarksville, most of the sidewalks were built 1950 or prior. The baby boom made us build houses at a much rapid state, and we couldn't keep up and put a sidewalk everywhere. And so I don't blame the builders or the city streets department prior to 1950 because they were just trying to keep up with 18 years after the baby boom. Those babies are 18 years old, they're adults, and they now need a place to live. And so, but we can look now at what we can do, and it makes you think that you're part of the big picture when it's explained that way. And of course, you and I have had these conversations a lot.
Well, you know, on a side note, since I was elected mayor in 2014, I've been able to sit on the Health Foundation board that you were on, and then you chaired it for a bunch of years. But now you're actually an ex officio, which I think was a great move. Unfortunately, I come off of that in August when I'm through with my second term. But man, that thing has been a godsend to our community.
It is a local, best kept secret. And we don't want it to be a secret.
Right.
We give out $1.8 million a year in grants that, if you could tell us the problem that you're trying to address, and this is our solution, and we need these funds to purchase the things and the services for the solutions, there's really not a lot of pushback. We give the money. We don't want it to be in the bank earning money. We want it to be
out in the community,
your idea. And you know, how many tens of millions of dollars have we given out in 9 years?
It's been awesome.
It's
hard.
It's $60 million or something like that.
It makes your heart feel good. So I'm gonna get back on script. So you're walking to the courthouse to a meeting, and you see this couple walking down the sidewalk, and they interrupt you or just ask you, say, you know, I'm looking for somewhere to go, or, you know, I'm looking for this location. And I know Joey well enough that Joey's probably gonna strike up.
They're gonna have to walk away from me if they want to end the conversation.
But so they tell you that we're thinking about moving here. Why would you tell them that they need to move to Montgomery County?
If you look across the nation, I can't afford to live in California. I'm not moving to California. I'm living here. The cost of living and the economic opportunity is here. That impacts health. If I can have a job and I can afford it, I'm gonna buy more nutritious food. I'm gonna contribute and pay taxes where you build sidewalks. And we have TVA here. The cheapest electricity in the United States is right here. You wanna live here. If you're looking for a place that's inclusive, economically inclusive, racially inclusive, they've ranked the top 274 most populated cities in the U.S. Clarksville's 35th most inclusive.
Wow.
That's probably, this and other reasons, is why we were the best place to live in Money Magazine.
I think you could sell somebody on moving here.
They only had a minute with me just for me to say that.
So what, Joey, why would you recommend a life of public service to somebody?
You know, you can get a job anywhere, but if you want to have a career, come here and work for Montgomery County.
Awesome. So my last question, what do you think has been one of the most gratifying experiences that you have had since you've been the public health director for Montgomery County?
Easy. The people.
The people. Awesome.
You know, Doug Weil and Governor Sundquist hired me. Whenever they're hiring someone that's going to be a state leader of one of these organizations, it's an agreement in the 89 counties that the governor and the commissioner of health and the mayor has to concur with that appointment. And I was appreciative to get the job then. I'm still appreciative now.
And Joey, you have to excuse me for this, but I know you've won some national awards. You've served on boards and stuff. So I just truly think it's, it's a testament of who you are. And Joey is never first. It's always the people first, and that's one of the things I admire about you so much. And I saw you during COVID, and you weren't only involved in every aspect of it, but you were there at the testing site. You were there being compassionate to the people, compassionate to the employees. And I mean, I can't tell you how many times we had these multiple text threads that you were on, Mayor Pitts was on, and I can just remember reading them saying, our people rocked it today. They saw 450 people or whatever, when they were doing tests. And then when we started giving the vaccines, I mean, you did the same thing, and then created partnerships with Austin P and all of that stuff in Fort Campbell. So I just greatly, greatly appreciate what you do.
You said something at the very beginning of this. I mean, it was like April of 2020 when it had gone on about a month. And we thought we were exhausted in April of 2020. Yeah. We were at the courthouse. Several department heads were in the audience, and you said, I can't wait until this stuff's over so I can just hug every one of y'all. I'm gonna hug you now.
Well, what a great way to end this interview, Joey. And I can't thank you enough for your public service. And really, the whole part of this, why I want to do this, is to be able to shine the light on people like you. That you're not going to be in the paper every day like the mayor, but dadgummit, you need to be, because you do great work. So I appreciate you, man. Thank you, Joey.